Welcome to Eating Well with Diabetes. My name is Phoebe and I am a part of the amazing registered dietitian team here at Lompoc Valley Medical Center. Let's get started with an overview. This education material is a 4-part video series where we will deep dive into diabetes management and how to live well with diabetes. This information is not meant to replace individual medical advice given by your specific treatment team. Members of the treatment team may include your primary care physician, endocrinologist, diabetes educators, and registered dietitians. We will begin in part 1 with diabetes basics, including what is diabetes, how is it diagnosed, and what can be done to live well with diabetes. We will then move into our nutrition basics, where we will be discussing our food groups, see how our macronutrients, carbohydrates, fats, and proteins, play many vital roles in the body, and deep dive into carbohydrates, our #1 nutrient of concern in diabetes management. We will take what we have learned in part 2 and apply it to real-world experiences, including reading a nutrition label, utilizing the plate method, and general portioning recommendations. We will wrap up in part 4, talking about how to make our lifestyle optimal for diabetes management, and go over a few resources as well. It is recommended to watch the videos in the order shown here, but the beauty of having a 4-part series is being able to tackle them in your own time and at your own pace. We will now move into part 1, Diabetes Basics. In this section, we will define diabetes, insulin, glucose, and blood glucose, outline the process of diabetes, review how diabetes gets diagnosed, the complications of diabetes, and finally, how we manage diabetes. Let's start with the definition of diabetes. Diabetes is a condition in which the body does not properly process food for use as energy. In order to better understand diabetes, it is important to define 3 main terms: insulin, glucose, and blood glucose. Insulin is the hormone produced in the pancreas that regulates the movement of glucose. Glucose is the #1 energy source for the body, specifically the brain. Blood glucose is the amount of sugar found in the blood. There are 4 main types of diabetes: type 1, type 2, gestational, and prediabetes. We will further define type 1 and type 2 diabetes later, but I want to take a minute to better define gestational and prediabetes. Gestational diabetes develops around the second half of pregnancy and does not always lead to a full-time diagnosis of diabetes. Gestational diabetes is likely due to hormones released by the placenta that raise blood glucose. Prediabetes is where your blood glucose and hemoglobin A1C, a lab value that we will discuss more later, are elevated, but not high enough for a full diagnosis of diabetes. Prediabetes is reversible with proper nutrition, medication, and lifestyle modifications. How does the body properly process food for use as energy? This varies based on the type of food we consume. The body gets energy from carbohydrates found in vegetables, fruits, and grains. When we eat carbohydrates, in this example, the carbohydrate source is the apple, our bodies break down the carbohydrates in the digestive system into glucose, our body's #1 energy source. Once glucose is made, it is taken into the bloodstream to be transported to our cells. The glucose is like putting gas into the gas tank of our cells to be used as fuel to get us through our day-to-day. Glucose cannot enter the cells without the hormone insulin being present. The pancreas releases insulin when it senses an increase in glucose in the blood, commonly referred to as blood sugar. Glucose is then converted to ATP, which is the energy our body uses on the cellular level. Another way you can think about insulin's role in digestion is as a lock and key. The cells are locked, as glucose cannot enter the cells without the presence of the key, also known as insulin. Insulin binds to the insulin receptor, which opens the glucose channel like a garage in order to let the glucose in. Why does this process not work in individuals with diabetes? In type 1, the body does not make enough insulin to allow the glucose to enter into the cells, causing a raise in blood sugar. In type 2 diabetes, the body does not respond to the insulin that is being produced, which also raises the blood sugar. Symptoms of undiagnosed diabetes include fatigue, muscle weakness, uncontrollable thirst, and increased hunger. Diagnosing diabetes involves getting blood work done. The labs taken reveal a measurement of sugar in the blood, a value called hemoglobin A1C. This gives you a snapshot of your blood sugar levels for about 2 to 3 months. We will start by looking at blood glucose. Your blood glucose naturally fluctuates based on when you eat, what you eat, and your level of movement throughout the day. With a diagnosis of diabetes, these numbers stay higher than the normal limits of blood glucose. Normal blood glucose while fasting, meaning no eating for 8 to 12 hours, is less than 100 milligrams per deciliter. Impaired blood glucose, meaning the blood glucose is elevated but not high enough for a diabetes diagnosis, is anywhere from 101 to 125 milligrams per deciliter. A fasting blood glucose with diabetes will be greater than 126 milligrams per deciliter. As stated in the previous slide, A1C is a great snapshot of what has been going on over time versus one blood sugar reading that could be an outlier and not a good numerical reference for the bigger picture. Normal A1C is less than 5.7%, while elevated A1C is anywhere from 5.7 to 6.5%, and a diabetes diagnosis can be determined with an A1C above 6.5%. Keeping diabetes under control by stabilizing your blood sugars can combat comorbidities that can be a direct response from poor glucose control. Uncontrolled diabetes can weaken the blood vessels, nervous system, kidneys, eyes, the circulation in our feet, our skin, including sores and pressure injuries, and the strength of our bones and teeth, as well as our cognitive function. While uncontrolled diabetes is dangerous and life-threatening, it is important to remember that well-controlled diabetes can lead to a healthy and normal life. When you are diagnosed with diabetes, the blood glucose and hemoglobin A1C targets, also known as our glycemic targets, are higher than what is considered normal. Our goal with diabetes is to stabilize and control our blood glucose to minimize risk of dangerous side effects. Our goal for fasting blood glucose is 80 to 130 milligrams per deciliter. Non-fasting blood glucose is the measure of sugar in your blood after eating. The target is to be less than 180 milligrams per deciliter after eating. Our hemoglobin A1C reading needs to be about 7% or less to be considered well controlled. This would indicate good control over the span of about 2 to 3 months. It is no lie that managing diabetes takes effort. It can feel intimidating to get diabetes under control, but once you make small changes over time that are feasible for you, the management of diabetes will feel less daunting. Along with personal recommendations from your treatment team, the overarching management of diabetes falls into 3 categories: nutrition, lifestyle, and medication management. We will be covering nutrition and lifestyle for the duration of this presentation. In individual sessions, we may briefly go over how medication management is going, but medication is a very personalized process that needs to be supported by individual treatment teams. General recommendations for nutrition and lifestyle tend to follow a similar pattern from person to person, but individual recommendations based on your personal treatment are always going to take priority. Congratulations, you have made it to the end of Part 1. In Part 2, we will be discussing some nutrition basics. Thank you for watching Part 1, and I hope to see you in Part 2.